I'm your host, Arin Sime. Welcome to the Scaling Tech Podcast, the podcast for growing engineering teams. As always, this episode is brought to you by AgilityFeet.com, providers of technical staffing and software development services in Latin America for clients globally. All right, I'm here in Mexico City doing recordings around AI engineering for the Scaling Tech Podcast. And when people talk about AI engineering, building AI applications, we tend to be very Silicon Valley focused in that conversation, which is a shame because it misses out on a lot. In Latin America in general, we have a tremendous amount of engineering talent and growing adoption of AI. And Mexico City is an interesting place to see kind of what's happening in that. This interview is part of a series I recorded in Mexico City in early 2026. I'm sharing each conversation here in full on YouTube, and they'll also be featured in an upcoming Scaling Tech Podcast episode, where I'll tie together the key lessons and themes. If you enjoy these conversations, make sure to subscribe to the Scaling Tech Podcast so you don't miss the full episode when it drops. You can find us on Spotify, Apple Podcasts, YouTube, LinkedIn, and at scalingtechpod.com. And I'm here in Mexico City with Dr. Carlo Angello Sanchez, resident doctor in vascular surgery. Dr. Carlo, thank you so much for taking the time to meet with me. I really appreciate it.
Thank you so much for the invitation. It's a pleasure for me being here with you.
You gave a presentation at the EI Expo in Mexico City this past weekend that I attended, and it was really interesting. There was talk at that conference about AI in a wide range of use cases, but definitely in healthcare, there's a lot of possibilities there. So I think that, there's a lot that we can discuss, but I think maybe I'd like to start with asking you, what does augmented medical talent mean?
Well, for me, this definition means different things. For example, medical augmentation with this AI application can be used in different settings, Mm-hmm. It could be augmented also in the clinical practice, in research programs, and doing some surgical practice, and also with administrative tasks. As you know, in Mexico, we have a lack of staff for doing specific activities. For example, when we are doing a surgery, we need some people who is filming or who's taking the notes. So using the AI could improve this. And for research, I think sometimes we don't have too much people, or we don't have internship trainees who are doing these tasks. And we as doctors or residents need to do this. So I think using these AI tools can help us to reduce the time searching for important information and summarizing all this info, and helping us to write some articles, obviously supervised by us, and is giving structure to this. Another important thing is, for example, when we are with a patient. Sometimes we are with a patient, and for us as vascular surgeons, we perform different areas for carotid disease, mm-hmm. for vein disease, aortic disease, and diabetic foot pathologies. So sometimes we need to take pictures of these patients, or we have to measure some diameters of different studies, and according with these measurements, we need to use a specific device. And when we evaluate a patient, we use different tools. For example, the ultrasound or the hand probe Doppler, which help us to make a better diagnosis. So if we summarize all of these devices, we can integrate a diagnosis, or perhaps we can have a differential diagnosis. Mm-hmm. So using different tools in AI can help us. For example, for the pictures, we can predict if diabetic foot ulcer can heal, or also if an artery or vein ulcer can heal, and which options can be useful for patients. Also, in the setting in Mexico, we can work in the private and public hospitals. Sometimes in most of us divide our work working in both settings. So all the patients have a different level of education, and when you explain a patient how to take care and how to have a better adherence to their treatments, these tools are important because you can write in words who are more easy to understand and to follow up these patients. Also, you can send some alerts to the patients and have better adherence, or give notifications if something gets wrong. I think generalizing, it's how can we use these tools in the vascular medicine.
Yeah, no, that's really interesting. And I think when we think about AI in healthcare, a lot of conference presentations talk about things like radiology and detection of, say, cancer in images, and you highlighted some other examples there around diabetic ulcers healing and things like that I hadn't considered before. But then it also goes beyond the potential use cases go well beyond imaging itself. And you talked about taking video and notes during surgeries, and during patient conversations and follow-ups with patients and all of that. It's very interesting. There's so many applications. I mean, really kind of touching every phase, it sounds like, potentially, of the doctor and patient connection. So how did you become interested in AI and healthcare innovation?
Well, this is so much fun. 3 years ago, I visited my university. They invited me to give a conference for some med students who were graduating for a leadership medical program who has my university. It's called Alpha at Anahuac University. So it was this now good friend of me who's now interested in applying for vascular surgery in the US, and now he's getting trained in Houston Methodist. And we started to collaborate together. I mean, at the beginning, he wanted to publish more articles and get it involved with this education medicine, and also publishing articles. So we start different projects at the same time. And as doctors, we have like a bad schedule, because we have like rounds in the morning, then we have to do medical consultation, surgeries, and after that we have to read like a lot. So it was like I didn't have enough time he had, because he was doing his social service and he had more time. So he had a small background in AI, and he started to teach me how to use it. He gave me like specific prompts to do specific activities, like how to do a proper research and how to write different articles. So at the beginning of the year, 3 years ago, we decided, and we said, we want to attend this conference, which is in Paris. We want to attend this one, which is in Washington, New Orleans. But we had a plan, and we said we want to do these activities. So AI helped us at the beginning with this. So when we both get involved in these activities, we started to use different tools which help us to do things faster.
Yeah.
And we could do many things. And people say like, come on, do you have like the time to go to the gym, go to go to the hospital, publish, give conference, many things. And I started to share this with other doctors which are my age, and older doctors who perhaps didn't have like the idea.
Right.
I'll give you an example. My chief director course, he started to implement AI with all of the doctors, asking, for example, in the morning, some questions about different pathologies. And as he asked us, when we didn't have like the answer, he said like, ask ChatGPT about the answer. So someone was in charge of this activity, and ChatGPT gave us the answer accordingly with specific references for us, and that's how we started to implement these activities. Sometimes, as I mentioned, every surgery we need to present before, during, and after the surgery. So it consumes a lot of time for us doing these activities. So I started to look for different tools who could help us to work better and have a better presentation, who can be more easy to understood for us and for the public. And these tools for AI help us summarizing an article accordingly to the surgery we did. Because if we, for example, are going to operate an EVER, which is placing a prosthesis in the aorta, we need to look for a specific article accordingly to this device. Possible risk, which patients are more candidates for this device, and what to do if something gets wrong.
Yeah.
So it prepares us, and sometimes it's different. It's hard, to find a specific article for this. So if you ask the AI to look for an article,
search everything at once.
it gives you many options you can use for that class. Another application is after the surgery, you have to do the same. Something gets wrong during the surgery and you have to solve it. So you have to look for an article about that complication and how to solve it.
Yeah.
So there's not too much information in PubMed, for example, which are websites that help you to find index information and validate it. And if you put that in ChatGPT or whatever, they give you all this information. So that's how we together discover many other applications. And for example, about ulcers and specific ways of helping patients to get their ulcer smaller, help us. We use AI to predict how to use in different settings. Varicose veins, ulcer, or vein ulcers. So basically, it's how it helps us, and also it helps us for presenting for different programs, because sometimes we need to have some interviews. So we submitted, for example, our CVs, and accordingly to this CV, we put a specific, we write like, in a year, I will apply to this specific program. Please review all the requirements, or the requirements are listed here. So accordingly to graduated medical students, residents, whatever, tell me what do I need to improve.
Right.
So we focus on that specific areas, which were our weakness, and also not all our weakness. I mean all the strengths we have.
Mm-hmm.
We ask AI, how can we develop more, and how can we improve better? Mm-hmm. So accordingly, not just based on AI, also based with our mentors, and we combine this, but because as we discussed during the conference last week, we need also to use our own thinking, and then decide what is better for us, and use our critics,
Mm-hmm. Use our own critical thinking. I think there was a quote that you had in the conference that I liked, that paraphrasing, but like, the future is not medicine done by intelligent machines, it's better care enabled by technology, right? And so that's the type of thing that you're talking about here. One of the things that you talked about a little bit there was how the documentation and reporting that needs to be done prior, during, and after a vascular surgery, and that's done by other doctors, and so it's very time consuming for them, so different ways that AI could be used in there as a way to make better use of that doctor's time, right? They would still be involved in that process, but that they're able to do it more efficiently, right? And you told me before about an example of one surgeon using meta glasses too to kind of help with that. Can you talk about that a little bit? That was an interesting example.
It was so much fun in the operating room. We had an open aortic repair because we screwed in with one of the doctors, and he recently bought his meta glasses. So he was taking some amazing pictures of every step of the surgery, which can help us later for education. As I mentioned, one of the ways that our hospital in Mexico is that we document everything from the beginning until the patient goes home. And even after the patient goes home, we have a presentation of every patient, like all the follow-up. So during this surgery, the doctor was taking specific pictures, like the skin incision, dividing all the abdomen, and identifying the aorta, the renal vein, dissecting every part to see all the aorta, every clamping, every suturing, preparing the aortic graft, and suturing the aortic graft, seeing if there's no leakage of the aorta, and also closing everything, and then a final picture of the whole team with the meta glasses. So I think this is amazing. I know, because sometimes as doctors, the junior residents who are in the US is the equivalent to the interns. They need to scrub in, they need to take pictures, and sometimes it's difficult because they can get contaminated, or maybe it's not a good angle, but if you are like looking with your glasses, it's
exactly what the surgeon sees.
It's much more better.
Fantastic. So, Dr. Carlo, what are some of the biggest challenges in hospitals today that AI can address? We've talked about some of the ways that it can help augment medical talent, but also in your presentation, you talked about the crisis around burnout in medical medical staff and being understaffed in general. Can you talk about that part a little bit more?
Yes. In Mexico, we do night shifts every 4 days, and during the whole weekend, we work 80 and above hours. So I think AI can help us reduce this burnout. And how? For example, in Mexico, for my program, it's a 4-year residency program, as it's a fellowship. Sometimes we have different activities which are time consuming. For example, writing all the notes for a patient, so it can be summarized with AI. Another example is that we need a checklist for all the material we need for a specific surgery. So if you ask GPT accordingly to a previous note of a surgical procedure, perhaps you can upload this PDF note that was taken years before, and you can ask, what do I need? So give me a checklist, and then it's easier for you. And then you just go and ask for this material, because as I mentioned, we don't have here like in specific staff who do that for us. So we are not just like doctors. We are just staff who go for that material, for a specific wire, for a catheter, for a certain medication, heparin, contrast, everything. So another example is me as chief resident. I need to do different forms, and sometimes I need to collaborate with different companies that come with us and educate us, give us different courses, different workshops, or who just talk us about different devices. So I need to make a calendar every year for that kind of things. Or sometimes I collaborate with my chief of department, asking for different material for all the material we're gonna use during the whole year. So we need to check how many surgeries we did the last year and the past 10 years, and accordingly with this we need to know about stats, but we don't know too much about stats. So if we use properly, we can say, ask GPT, we have 100 surgeries for aorta in the past year. So tell me how many catheters, wires, whatever we need. According, if we are 13 residents, 7 attendings, and you can put different variables accordingly to that. So this could be like time consuming in the past, but now you can use it in your favor if you know how to use this tool. And accordingly to the burnout, last year my ex chief of residence, I saw he was burnout because he had too many activities to do. He didn't use and didn't know how to use properly, and I was joking with him, and sometimes I try to help him to use it, because I use it but just in my academic things, but not in this administrative sort of things. Because another example is how to request for a device, or how to ask, how to make a resume of some information for a patient. So if you write down what you want, you can also make a specific form and save time for do this. Also for the interviews.
Yeah.
4 or 5 months ago, we had the interviews for our new residents. So during this weekend, we have a talk about recruiting some people. At the end, the decision it's not for AI, but the decision it's based on analyzing all this information they gave you. But at the end, the director programs or the people who is doing the interview can have a better decision using all this information. So it's less time consuming and help you to do more things. And I've seen that it's easier.
Yeah.
An activity that in the past take you 2 hours, it can be 10 minutes because you need to review. I mean, I'm not saying that AI is going to do everything and you're not reviewing all this information. You need to review this information.
And what's interesting to me about the examples you were giving there is that most or maybe everything you said were things that were done outside of the meeting with the patient, right? And often even outside of the surgery, right? So if doctors are spending so much time doing all of that paperwork and reporting and research and analysis and, analyzing statistics from the last year of surgeries, as you said themselves, and then on top of that, they still have to fit in the time with the patients. You can easily imagine how they would be burned out and have less time with the patients. So I think, as is often the case with AI, what we're talking about here is not replacing that doctor-patient relationship. It's making the rest of the doctor's work more efficient and easier so that they are less burned out and then have more time for the patient interactions or the surgery or training and education and things that they, are probably more excited about doing than the paperwork, right?
Yeah.
Let's talk a little bit about regulatory, privacy, security concerns. What are some of the hardest things about using AI in a hospital? Or is it in those areas, or would you say other areas?
Well, I think one of these regulatory things is that every patient absolutely needs to sign consent information. It also enters the ethics. I think this information can be used. It could be used for good or for bad things.
Right.
So it's very sensitive information, and every patient deserves to know about where is their information. The hospital where I work, they have a system which it's only at the hospital. It's not shared with somewhere else, and all this information don't have like a name. For example, when you use it with AI, because you have like just male, female, that's it. But you cannot put the name of the patient, neither sensitive information like their own ID. You just analyze a specific case. For example, male, 45-year-old, who has diabetes and is not well controlled and has a diabetic ulcer with no distal pulses. About his meds, about every other risk, if he smokes, and that's it.
Right. No identifying
information.
Yeah.
So the patient only knows that if their information is used for a protocol, they sign a consent. Every time the patient is admitted to the hospital. So, and also the pictures we took, they before need to sign a specific consent. telling we're taking some of these pictures.
Yeah.
And some patients can refuse, and they say, okay, and it's okay. We don't have like any problem with this. So I think that this information can help us to have more statistics, specifically here in Mexico, because most of the data we have is 10 years ago published. So we don't have like too much information about this new era. For example, there are new medications which we know are good for the patients based on countries who are more developed and who have all this infrastructure and have all this investment in publishing and doing some research. And now the populations and the different pathologies and the education level, it's not the same comparing first world country compared with Mexico. But we use some of these guidelines which are published. So when we have this sensitive information, we can ask different AI tools accordingly with this guideline. What would you recommend? I think, and I highlight important information that me as a clinical doctor and a vascular surgeon, I can identify, and I say, I think this patient has 70% of losing of having an amputation. So I say, and I ask AI, like, give me another options, and perhaps some options I'm not thinking about them at the moment, and can help me, or sometimes as I mentioned, you try to be more human. Sometimes doctors can say, okay, there's no other option, and if I can use this tool and there's something which was published yesterday, for example, I can use OpenAI to see if there's something new I can offer and give another opportunity for the patient, or having better outcomes. Sometimes, for example, in aorta pathologies, there is a specific area which is complex aorta, and complex aorta limit sometimes the use of different devices because of the length, the diameter of the aorta. If it has too much thrombus, calcium, or neck angulation, there are no devices which can fit the aorta. Sometimes the patient is not candidate for an open surgery because the patient has a lot of cardiac risk and the patient can die during the surgery. So you need to evaluate this, and I think with this implementation of imaging analysis, you can do this. Right now, what we do at our center is that every surgeon measure the diameters and present a plan for this surgery. We send this image to the chief or the senior surgeon, and also is evaluated for the sales manager and the specialist of the product. So it's evaluated by 3 people who at the end decide which is the best option, and what if we can implement a 4th one, which can be AI. We can have better outcomes if we combine 4 of us deciding what it's better, because when we have no option, there's another one which is the physician modified endograph, which is handmade before the surgery at that moment.
Right.
The patient has general anesthesia, and the surgeon it's doing a handcraft art at that moment. so that's one of the areas we are more passionate about, because it helps us and gives you more ways of thinking what we can do for these patients, because it's a combination not just of medical thinking, it's about engineering, and tech, everything.
Yeah, absolutely. No, that's really interesting. I imagine that sometimes you must talk with colleagues, with other doctors and surgeons who are maybe more skeptical about using AI in their process, even though there is always a human in the loop. And, you mentioned in that example 3 other humans, who are all kind of double checking the situation. But what do you, how do you talk to colleagues who are skeptical about applying these new technologies to healthcare?
Well, as you mentioned, there are some people who's skeptical about this, even though we are in the 2026.
Right.
And their mobiles also have the AI integration. Right. But I think that showing them an example of success is a better way for do that. And giving them the opportunity to teach them and having the time to tell them how to use it, because if they don't do it, perhaps they are not going to use it in their daily practice. I mean, the final decision it's by us, by the doctors. So it's like the beginning of a new era, that AI is not to replace us, it's to augment us.
Right.
It's a powerful tool that we know how to use it, make us just more productive. As I told you, 3 years ago, I was a standard student, or maybe I have more lack of sleep. But during these 3 years, I increased my potential much more. I mean, I could attend last year at least 5 international conferences, which I didn't attend the years before. And the opportunity to publish more, to see more patients, to have more surgeries, and to ask also. With these videos, I have like the idea of just watching the surgery and comparing it with some surgical lessons, perhaps. And I don't know if there exists like an AI tool that can tell you, okay, you didn't do this well, you need to improve in this. For example, I know that it exists, for example, for cooking. I can, because there are steps. In surgery, it's the same. It's step 1, step 2, step 3. So I think that if it analyzes the image and they give you like a feedback. So I think there are a lot of ways, as you mentioned during this whole conversation, that you can apply and use it in your daily practice. Not just as a doctor. I mean, whatever you do in your daily life, it can help you.
So implementing AI in all these creative ways that you've done and that you've seen in medicine is making you a better doctor, giving you more opportunity to learn, to interact with patients, and do a little bit less of the still doing and involved in that paperwork, but in a more efficient manner. And Yeah, so I think you mentioned doing video AI does already exist for doing things like watching you do a recipe and giving feedback, or gym workout scenarios, right? Like did you go deep enough in your squat, or in your bench press or whatever, right? If someone's not already working on it for medical training, then maybe someone watching this wants to start, because I'm sure it's on its way, and so yeah, there's so much that you can already do with AI now in medicine, and no doubt much more to come. So, Dr. Carlo, thank you so much for your time. I really enjoyed the conversation, and thank you for sharing all of this information with us.
No, thank you so much. It was a pleasure for me.
Thank you.
Thank you.
Thanks for watching. I hope you enjoyed that conversation. This interview will be part of an upcoming Scaling Tech podcast episode on AI engineering in Mexico, along with insights from multiple other conversations I recorded there. Be sure to like, share, and subscribe so you don't miss it. You can find links to all our episodes, socials, and show notes at scalingtechpod.com.